My name is James Ruskin. My professional background, I went to dental school at the University of Florida College of Dentistry in Gainesville, Florida. I then came to the University of Nebraska Medical Center, where I went to medical school and finished my oral and maxillofacial surgery residency training. I then was on the faculty at UNMC for 5 years before I went back to the University of Florida, and I was an attending at the University of Florida for 21 years. Then I went to the University of Colorado, Denver Health Medical Center, and I was there for the last 2.5 years, and now I've just rejoined the faculty back at UNMC. I became a physician because I felt I could really impact people's lives and outcomes for diseases and conditions that patients had. I actually was observing an oral and maxillofacial surgeon at a hospital in Miami, Florida when I was in high school, and watched him rearrange literally somebody's face. It's called orthognathic surgery. And from that standpoint, I felt that I really wanted to become an oral and maxillofacial surgeon. Probably the last 15 years, what I've done the most is implant dentistry and reconstructive surgery. So my patients ask, well, what do you like to do? I like to reconstruct jaws, rebuild jaws either from cancer surgery or motor vehicle accidents or developmental anomalies, and rehabilitate people by placing dental implants and allowing them to have teeth and the ability to chew again. When I first sit down with a patient, I'm trying to establish rapport with the patient. I want them to know what I'm like, I need to know what they're like, and we need to communicate and be able to communicate, because to me, communication is the most effective means of keeping in touch with patients and understanding each other. There's a lot of things that I do that patients may consider to be medical speak, and I need to make sure that they can understand it on person-to-person speak and forget the medical speak. And so the first thing I'm trying to do is just establish some rapport. Eventually, we'll get to why they're there and how we can help them. But at first, I just need to get to know them as a person. So I started my career at the University of Nebraska Medical Center. And I started out doing bench research, which is animal research. But that quickly led to clinical research. And I was very fortunate to be able to do some research with some international well-known people on guided tissue and guided bone regeneration. And I've continued to do that up until recently. I still have some clinical research projects going on that deal with guided tissue and guided bone regeneration. But the best thing about working for UNMC is the people. They are phenomenal.